One of the main goals of the Affordable Care Act was to provide access to health care coverage to all Americans, and the expansion of Medicaid eligibility was a fundamental step towards achieving that goal. And I'm pleased that New Jersey is among the states that expanded their program. But I'm also concerned by some reports, including one in this morning's National Journal, about how Medicaid applications are being processed in several states, including New Jersey. Specifically, I'm hearing about extensive backlogs caused by the New Jersey Medicaid Department's need to input the applicant's information by hand in the 21st century. I'm not quite sure, but and despite the no wrong door policy that allows Medicaid enrollment via the state or the marketplace websites, the online applications are apparently just being printed out and manually input into the system. In Camden County, New Jersey, for example, there's a reported backlog of 10,000 Medicaid applications and only about 6 data entry personnel, meaning it would take nearly a year and a half to clear the backlog. So that's clearly an issue of concern as people are waiting for their enrollment verification so that they can see their doctor. What steps will be taken to address the current backlog and to prevent more from happening in the future applications?
Well, Senator, we share your concerns, and frankly, it's not just states like New Jersey expanding Medicaid, but it's states across the country who really have been on notice since the law was passed 4 years ago that they needed to update and upgrade their eligibility systems to make it seamless and easy for people to enroll. And we are still finding a number of states, like New Jersey, that are not ready to receive automated data. We're working closely with states around the country and frankly, share your frustration that there are people waiting. There are also people probably in that line who may think they're Medicaid eligible, who are really marketplace eligible, and they don't even know that yet. So that's an additional problem. But in terms of the automated system, the federal system is ready to send automated reports and receive automated reports to try and seamlessly do this. We are actually kind of ramping up the pressure on states, and we'll look at potentially some administrative reductions in payment if people don't pick up this pace, because having a backlog that is not being processed in a timely fashion is just keeping way too many people from the health care that they are entitled to.
So in essence, states that have this backlog is because of their own lack of performance?
Well, at this point, yes. The federal system did take a while to get to the point where we could actually process it electronically, but we're now at the point where we're able to input the electronic files. What we have is a system that goes back and forth between the states. So somebody comes to the state level and is marketplace eligible, somebody comes to the federal level and is Medicaid. But most of what New Jersey is seeing is actually the New Jersey system not being able to keep up with the numbers of people who are qualified.
We'd love for you, the department, to keep us abreast of how we're going to make progress.
We would be glad to do that.
That's a lot of people. Finally,
Yep.
Last year, CMS devised a new rule to determine whether or not a Medicare beneficiary would be considered an inpatient or an outpatient during their hospital stay, solely based on whether their hospital stay spans more than 2 midnights. And while it helps clarify some issues, we've all heard about beneficiaries spending a week or more in hospital under observation status. The rule fails to acknowledge an instance where a beneficiary needs a high level of inpatient care for a shorter amount of time, even if the physician determines it's medically necessary or appropriate. And I think CMS has already acknowledged that there are problems with the rule and has delayed it on a number of occasions. Additionally, Congress just stepped in and imposed a statutory delay as part of the recent SGR bill prohibiting enforcement until March 31st of 2015. I have a bill with several members of this committee who have co-sponsored called the 2 Midnight Rule Coordination and Improvement Act. But what's more important to me is that CMS has the existing authority to implement the provisions of this bill, which basically is to have CMS consult with outside experts like hospitals and physicians to develop the criteria and methodologies that ensure beneficiaries in need of a short stay inpatient care are able to receive it, and to make sure we don't have those long stays when they're not necessary. So can you give us some sense of whether we can make progress here without necessarily dealing legislatively with it?
Well, I think the fact that Congress, as you say, has chosen to delay the implementation, we will certainly be looking for strategies. I know there was a lot of consultation earlier, but I would love our staff to circle back with you and your staff to see what the elements are in the bill that we could perhaps move forward on an administrative basis.
All right. Thank you. Senator Fisher, it's a bipartisan bill, so I hope we can do that.
Great.